AMG 330 is the sibling of blinatumomab. It's a CD33 targeting T-cell recruiting antibody construct that has been tested in a phase 1, and 60 patients have been recruited to the trial so far. And the most common reported immune-related adverse event is the cytokine release syndrome. And this brought in the necessity to implement dose steps to mitigate the observed CRS. And through the different dose steps, we have lost some time in recruitment, and so far there have been now implemented 3 dose steps, and we are still increasing the dose. We could show with the implemented dose steps and integration of steroid pretreatment that the antibody is tolerated and the safety profile is acceptable. So we could prolong the time of infusion, as this is given as a continuous infusion, to 28 days. And as I said, we are still going up in the dose. We have seen responses in the higher doses, but we hope that we will improve response rate as we go higher up. One also has to point out that patients that have been integrated in this trial have been heavily pretreated. So half of these patients have received 4 or more prior treatment lines. Half of these patients had already undergone allogeneic stem cell transplantation, and up to 60% belong to the adverse genetic risk profile. So I think we can conclude so far that it's safe, it's feasible, that it's still ongoing. We are not in the expansion phase yet. And I think we clearly have to move this molecule up front. And I'm very happy that we will also open up a cohort where we will treat MRD positive AML, where I think this drug will have a much greater success and response rate. And the other challenge is clearly the continuous infusion. And a second trial, AMG 673, is utilizing the same molecule, but this is now a half-life extended molecule with a non-functional FC domain. So this can be given as a short-time infusion for half an hour and is given on day 1 and 5. And to this trial, we have recruited now 30 patients, and it has the same principle to mitigate CRS. We are moving up the dose with implementing dose steps, and we are just moving up. Out of the 27 available patients in this trial, 11 patients showed a response with a reduction of blasts within the bone marrow. So I think this is promising. Again, CRS as the most common adverse event is feasible while implementing dose steps. And this trial clearly is still recruiting patients. And lastly, I just want to point out the most advanced bispecific is the 123 DART blinatumomab. And I think interestingly, and that was shown last ASH, patients that are primary refractory were the patients who responded best. So I think from all these 3 trials, one can say we are treating patients probably too late in treatment line. We have to move these drugs earlier where we have a more fit immunocompartment. But I think through implementation of those steps, at least we can manage and apply this drug safely.